Hello everybody, my name is Crystal Spence. I'm one of the community health nurses here at the Peguis Health Center. I'm here to share some information about the measles situation everywhere in Manitoba, Canada. Since 2025, there are 355 confirmed lab cases in Manitoba and 29 probable cases, although there were thousands of confirmed cases across Canada. Probable cases means people with clinical symptoms but never lab confirmed. Manitoba has been experiencing a significant measles outbreak that began in early 2025, which has been the largest since measles was eliminated in 1998. Hundreds of confirmed cases have been reported, with many exposures linked to community events such as Winnipeg Jets games or concerts and public locations where infected people were present. So we just try to remind people to be careful when they're at large gatherings. Some of the hotspots that we have been aware of or made aware of is Percy Moore Hospital and other close community clinics like Gimli Hospital, Arborg Hospital, places like that. And they've been identified as measles exposure sites. Manitoba Health publishes up-to-date exposure locations online. Measles is a highly contagious virus and is spread primarily through respiratory droplets when an infected person coughs, sneezes, breathes, or even talks, just like how COVID was. The virus can linger in the air and on surfaces for up to 2 hours after an infected person leaves. Good hand washing is recommended and sanitizing your environment regularly. An infected person is contagious from 4 days before the measles rash appears up to 4 days after the rash appears. Symptoms of measles can appear 7 to 21 days after being infected with the measles virus. Initial measles symptoms include fever, cough, runny nose, red watery eyes. Approximately 3 to 7 days after a rash appears, the rash looks like red blotchy spots. It starts on the face and then spreads down to the body and legs. May look different or not develop in people who have weakened immune systems, and it can last 4 to 7 days. Measles are diagnosed by preferably nasopharyngeal swabs, just like the COVID swabs, but it can also be done by urine tests for viral detection and blood work. There's no antiviral treatment for measles infection. Medical management is supportive and aimed at symptom relief and management of complications such as secondary bacterial infections. If a person is exposed to a positive measles case, they should contact public health to check vaccine status. And if they are not up to date, they should have measles vaccine within 72 hours after exposure to prevent and reduce severity of the measles infection. People who have been exposed should monitor for symptoms for 21 days after exposure. You can call the health center to speak to a nurse on call to ask questions about you or your family's measles vaccine status. In Canada, adults born before 1970 are generally presumed to have acquired immunity due to the infection with measles when they are younger. Measles can be prevented with vaccination. 2 doses of the MMR and MMR vaccine are recommended. 1 dose is given at 12 months of age. The second one is given at 4 to 6 years of age. In Canada, adults born before 1970 are generally presumed to have acquired immunity due to the infection with measles when they were younger. So that's why we're doing the 2 doses. The one at 12 months of age and the second at 4 to 6 years of age. Due to the current measles outbreak across Canada, there's an expanded vaccine eligibility criteria which recommends infants aged 6 months to under 12 months who reside in or who travel regularly. Additionally, infants receiving an early dose of MMR should still receive 2 doses of MMRV after their first birthday and at least 4 weeks after the previous dose of the measles-containing vaccine, which would have been the MMR, to ensure long-lasting immunity. All adults born in or after 1985 are eligible for 2 doses of MMR vaccine. Adults born between 1970 and 1984 are eligible to receive 1 dose if they do not have documentation of receiving 1 dose of an MMR vaccine or a history of laboratory-confirmed infection or laboratory evidence of immunity. So now we just encourage people who have weakened immune systems to wear masks for protection when they're attending community events or public locations where there's large crowds. And then that includes attending appointments at any clinic or any hospital setting. if you think you need the measles vaccine, you can contact us. We have records of all people living in Manitoba who've had vaccines in the past. If there are people that are living in Peguis, we have hard copy charts that we can refer to. If there's only one dose of the MMR vaccine recorded in that, then they're eligible for one more dose. Or if there's people that are traveling and they know they're going to be traveling to places where measles is prevalent, then we can offer a dose of the MMR vaccine.
Perfect.
MMR vaccine is a live vaccine, so it has potential to cause fever. For the first 48 hours after the vaccine's administered, take Tylenol or Advil as needed. Another one of the side effects of the measles vaccine is a measles type rash 10 to 14 days after the vaccine's administered. It doesn't happen with everybody, but sometimes it does. So if it does, that's an expected immune response.
Can I get one now?
Yep.
Can you check if I need one?
Yes, I can for sure.
Yeah.
1, 2, 3, poke. Done.
You did it already.
Mm-hmm.
I didn't even feel it. I was going to yell. I was going to yell.